In August 2026, a hospital in Tennessee did surgery on patients. At least one patient is now permanently paralyzed. What happened? There was a medication error and it looks like it affected at least 4 patients. An epidural is a local anesthesia that's injected into the epidural space in the spinal cord. This is to numb the spinal nerve roots traversing the space and prevent really any kind of sensation while they operate on you. Local anesthetics are given here very often bupivacaine. The nerves use electricity to move signals to and from the brain. In humans, the movement of sodium and potassium ions in and out of cells is our version of electricity. Bupivacaine blocks the movement of sodium, so then a feeling, a signal, whether it's pain or touch or pressure or temperature, isn't sent. When doctors and nurses are attending to a patient, there's a lot of people and a lot of moving parts happening all at once. Sometimes a patient who needs an epidural needs a regular saline water IV. But in a rush, medical staff might mix up that saline bag with a bag of bupivacaine. Then bupivacaine gets into the bloodstream. It gets to the heart, it blocks sodium movement, and then the heart shuts down, and then the patient is gone. This has been famously documented to have happened before certain systems were implemented. We now have huge labeling saying for epidural use only. Epidural medicines are stored separately from everything else, and physically the connectors are different. So then what happened here that at least one patient is now permanently paralyzed? We don't know much outside of what this article that was published says. There's an active state-level investigation happening, but potassium chloride was given instead of bupivacaine. I don't know how this was prepared, but potassium causes severe extravasation injury if not diluted before injected. So this will cause extreme nerve damage if given like an epidural mistaken as bupivacaine. When these get prepared in the hospital pharmacy, it gets done in a clean room, and the technician who makes it has to leave out all the vials used to prepare that particular bag or syringe. The pharmacist checks it systematically, patient label and records all reviewed, and then signs their name off on it when they confirm. Then anesthesia staff checks it before administering it to the patient. I would hope that a pharmacist didn't check off a potassium vial, mistaking it for bupivacaine. There's so many visual markers showing that they're not the same thing. At least 4 patients, potentially on different days, suggest that something enabled the same mistake to happen multiple times. A one-off would be someone's fault. 4 times in a row? We really got to see what that investigation says.